Good afternoon. So welcome back to Monday Reading Live. This is me Vandana PS joining you from Neetu's Academy. Okay, so anyone attending this live session for the first time? Let me know in the comment box. Okay, any students? Alright, so as usual, in this video, we will be dealing with a sample question from part B. So then I'll discuss about part B in detail after this question. Then we will move on to part A. Okay, so I'll give you 2 minutes for this question, this sample question. Then we will discuss the answers. So here comes the question. Okay, so yes, coming back. So all done the question, this particular question? Okay, Sobi, Reba, Clarina, good afternoon. Yes, Sobi, I'm good. What about you? Okay. Okay, so this question. So as usual, yeah, I'll always give you a sample question from part B. So what about part B? What do you guys know about part B? Okay, so in part B, as you know, we have 6 questions in total. Okay, and out of the 6 questions, I can say we have to finish the 6 questions within 12 minutes. Okay, maximum you can take 10 to 12 minutes for the completion of this 6 questions. Okay, and what about the type of questions? So, multiple choice questions with 3 answer options, and you have a respected paragraph here. Okay, and in part B, these questions will be from the 3 categories. Okay, maybe from the first category or second category or third category. Okay, so what about the first category? Any idea? So first category, which means it will be a guideline. Okay, so what are guidelines? Guidelines, which means a set of rules and regulations that someone has to follow. Okay, and which sentence is important? The first sentence is always important. And the second category, which is email, comma, policy. So what are not email, manual, comma, policy. So what are manuals? Manuals, which means a small booklet that contains all the information about a particular device, machine, instrument, equipment, or medicine. Okay, and another one is policy. And as you know, policy, again, same thing. It will be all of a, for example, what can I say about a particular act and that we have to follow. And what about the third category, which comes under email, then memo, or notices. So email, comma, memo, comma, notices. Okay, and what are you reading for in the third category? We are reading for the purpose. Okay, so this particular question can be categorized into the third one, which is a notice. Okay, because this is not an email or a memo, there is no sender, no receiver, so that can be connected with a notice. Okay, yes, Helen Francis, good afternoon, dear. Okay, so coming back to this question, what 3 options? So the first important thing is, okay, already I've given you 5 different strategies or 5 different steps to do the question. So the first step is read the question. Okay, so you can read the question. So what 3 options are generally available for discussion when a person is faced with making a decision about what treatment pathway to take for their illness? Okay, so what is the second step? Underline the keywords from the question. So when you underline the keywords, always think that these keywords will help you to understand the question. So it is important to understand the question. Okay, so what are the key points here? This is a very lengthier question, but we can underline maximum 3 keywords, separate words, okay, or individual words. So my keywords, 3 options, then discussion, as well as treatment pathway. Okay, so these are my keywords from the question. Clear? Then what is the third step? So either you can read the questions first, the options first, or you can move to the paragraph. Okay, so after reading the question, then underline the keywords from the question, then understand the question, and you can move to either the options below, or you can move to the paragraph. Okay, so whatever it is, please understand the question. So otherwise your answer will be wrong. Okay, Reba. Yes, dear, the first category is guidelines. We are reading for the details. Second category, manual or policy, and we are reading for the main idea. And the third category, email, memo, notices, we are reading for the purpose. Very good. Okay. Yeah, so coming back to this particular question. Okay, so I'll read the paragraph first, then we will move to the options. Okay, it's up to you. If you want to read the options first, then you can go with that, or otherwise you can read the paragraph first, then find out your answer from the 3 options. Okay. Yeah, so I'm reading the paragraph. Okay, so therapeutic objectives in the elderly. Then, when treatments are very likely to achieve benefits and very unlikely to have adverse effects, decisions are relatively easy. However, assessing the relative importance of these quality of life factors to each patient is important when treatments may have discordant effects. For example, aggressive cancer therapy may prolong life but have severe adverse effects such as chronic nausea and vomiting, then mouth ulcers, that greatly reduce quality of life. Then in this case, the patient's preference for quality versus duration of life and tolerance for risk and uncertainty help guide the decision whether to accept cure, prolongation of life or palliation. The patient's perspective on the quality of life may also affect treatment decisions when different treatments such as surgical versus drug treatment of severe angina or osteoarthritis then may have different efficacies, toxicities or both. Then practitioners can help patients understand the expected consequences of various treatments, enabling patients to make more informed decisions. Okay, so that's all about the paragraph. Okay, so any idea what is the correct answer here? So B, 𝐕, yes, any idea what will be the correct answer from these three options? So I'm going to read the options now. Option A, modifying their lifestyle to deal with the illness, accepting that they cannot be cured and taking all treatment options available. Then second one, managing the side effects of treatment, then consider declining treatment, revising their expectations of whether they will be cured. And option C, extending life expectancy, treating the symptoms to lessen their effect and remedying the conditions. Okay, so these three are the options here. Any idea? Okay, so B, option A. Okay, 𝐕, option A. Any other answers other than these three options? Confusing with C also. Okay, all right. Okay, so if I'm just giving you a chance that you can eliminate option C, how will you eliminate option C? Okay, or I'm just giving you a chance to eliminate option A, how you guys will eliminate option A? Okay, so the method or the strategy we are using here, that's called elimination method or elimination strategy. Other than that, we have no other methods here, right? Okay, so what is elimination method? We are removing certain options and finding out the correct answer. Okay, yeah, so what about option A? So when you read a question, always connect with your options, okay? So the first one, modifying their lifestyle to deal with the illness, okay, that is mentioned. Then accepting that they cannot be cured. So what about that one? Okay, the problems cannot be cured. Curayan pattilla, okay, cannot be cured. So where is it mentioned? It cannot be cured. And taking all treatment options available. So what about all treatment options? Okay, so because of that two reasons, I mean, they cannot be cured as well as all treatment options, I can eliminate option A, okay? So we are eliminating option A because of these two reasons, because it is not mentioned anywhere regarding they cannot be cured. Okay, then what about option B? Managing the side effects of treatment, consider declining treatment, revising their expectations of whether they will be cured. Again, so there is no doubt in that option B is not mentioned anywhere in the paragraph regarding managing the side effects of treatment. Okay, maybe management can be done. Considering declining the treatment, which means we are stopping the treatment. Okay, anywhere in the paragraph they have mentioned about stopping the treatment or declining the treatment? No. Okay, so we can say it's not mentioned, no, it actually does a contradictory option because declining the treatment is not mentioned anywhere. So yeah, contradictory option, or I can say opposite option. And what about option C? Extending life expectancy, which means prolongation of life. Okay, then treating the symptoms to lessen their effect. So again, for the prolongation of life, you can reduce the side effects. See, may also affect treatment decisions when different treatments may have different efficacies, toxicities or both. Practitioners can help patients. Okay, so we have certain methods to reduce the condition. Okay, then what about remedying the condition? That is actually in the final line. Okay, so they can help, the practitioners, the doctors can help them to treat the condition, to understand the condition and to help to treat the condition. Okay, so yeah, so answer is option C, whether you like it or not. My answer is option C. Okay, so which is extending life expectancy, then treating the symptoms to lessen their effect and remedying the condition. So that is the correct answer. Okay, hi Mariamma. Yes, good afternoon dear. Yes, Ruby. Okay, Ruby. Yes, so be clear. Okay, dear. Option C, very good. Yeah, so option C is the correct answer. Okay, little bit lengthier question, little bit lengthier options, but the paragraph is quite okay. Yeah, so that's all about part B. I'll just summarize about part B now. So we have 6 questions in part B, and these questions are in the type of multiple choice questions with 3 answer options. Okay, and you can do elimination strategy here. Just eliminate the options which is not mentioned maybe, or contradictory option or opposite option. and you can find out the correct answer, and then you can do part B in 5 steps. Okay, within 5 steps. So the first one is read the question, then second step underline the keywords from the question, then third step understand the question. So that's the important point. Okay, then either you can read the paragraph first or you can read the options, then do elimination. So these are the 5 different steps to do part B. Okay, and what about the strategy? I already have told you, it's elimination method. Okay, then yeah, so that's all about part B. Okay, and what about the time? It's all about 10 to 12 minutes. Okay, so now we are moving to the most important part, which is part A. Okay, so the topic is bad breath. Yes, how is the material? Was it too difficult or average or very easy? I think it is very easy, right? Okay, so B, yes, Reba, how is it? How is the material? Okay, very short paragraphs. Okay, so let's condense about part A first, then we will move on to the questions, okay? So what do you know about part A? Let me know in the comment box. Okay, Celine, very easy, very good, yeah, yes. Okay, so let me know about part A in the comment. So what do you know about part A? About the time, about the strategy we are using, okay, about the type of questions, then easy methods. Okay, so what about, okay, Reba, it was very easy, okay. So what about the method we are using? Any strategy? The total number of questions? Any idea? Okay, so total we have 20 questions in part A. So 1 to 7 set of questions that can be called short answer questions, right? Okay, 1 to 7 set of questions called? Okay, not short answer, it's match the following. Okay, then 8 to 14, that can be called short answer questions. And what about 15 to 20? Okay, so those are fill in the blanks. Okay, a lot of comments. Okay, Maria, 15 minutes, 20 questions. Okay, so be 15 minutes, 20 questions. Okay, and Maria, it's skimming and scanning. Very good, dear. Okay, so what is skimming and scanning? Let me know in the comment box. What do you know about skimming and scanning? So, I mean, what is the meaning of the word as well as why we are applying this technique, okay? Okay, Anjali, 20 questions and 15 minutes, okay? Yeah, Celine, fill in the blanks. Okay. Okay, Reba, 1 to 7 match the following. 8 to 14 short answers. And 15 to 20, fill in the blanks. Okay, dear, very good. Okay, Anjali, Anju, skimming and scanning. Okay, so what is skimming and scanning? Tell me, what is skimming and scanning? Actually, what is the meaning of the word skimming? Searching, yeah, it's called scanning. And what about skimming? Okay, Mariamma, yes, skimming, which means fast reading or speed reading. Very good, yes. Okay, so you can, first of all, you can take the first 2 minutes just to skim the text. Okay, as well as you can scan, which means when you fast read all of these texts, you can underline certain important words from each of the text. Okay. So we have a new topic, that is bad breath. And what about the text? We have text A, text B, text C and text D. So each of the text will be different from one another, and one of the text will be a pictorial of something, okay? Yeah. Okay, Anjali, fast reading, which means skimming, very good. Okay, Reba, quick reading, searching for important words, yes. Okay, Anne Maria, fast reading, okay, so B, fast reading and scan the important key points, very good. Okay, Reba, important words, 13 important keywords. Okay, so actually, this 13 important keywords, which means you can, when you read this text, okay, so when you go through or when you read this, each of the text, you can underline 13 important keywords from that, okay. So what are the 13 important keywords which you guys know? Okay, if you don't know the complete 13 words, just tell me at least 5. So what are the keywords from the text? Okay, and you guys told me we have 13 important keywords. So what are they? Any idea? What are the 13 keywords from each of the texts? Okay, not 13 keywords from the text. Yeah, maybe you'll get, maybe you'll not. Okay, for example, The first one is all the headings. Okay, so sometimes they will mention the heading, sometimes they will not mention. So whatever if it is mentioned, you can mark all the headings. Okay, so likewise, what are the keywords? An idea? Yes, Sobi, yes, Reba, Anne Maria, Mariama. What are the keywords from the texts? Okay, so I'll tell you what are the keywords, then we will move on to the questions, okay? Okay, Reba, yes, heading, subheading, number, signs and symbols, abbreviations, names, brackets, italicized word and bold letters, okay? Okay, Mariama's Karia, it's heading, subheading, all the numbers, all the names, anything else? Okay, so I'll mark all the, I'll tell you what are they. All the, first one, all the headings. Then second one, all the subheadings, okay? Yeah, then third one, all the signs and symbols. Okay, signs and symbols, which means maybe a percentage signs will be there, less than or equal to, greater than, okay? So all the signs and symbols. Then all the numbers. Okay, so whatever numbers mentioned in the paragraph, you can mark all the numbers, maybe it is in figures as well as in words. Okay, so whatever it is, mark all the numbers. Then all the names, maybe names like name of a person, name of a disease condition, name of an instrument, name of a country. So whatever names mentioned, you can mark all the names. Then next one, all the abbreviations, okay? Abbreviations, which I can say all the short forms. Okay, so I think there is no short forms in the paragraph, I mean in the text, yeah. So somewhere I noted GERD, right? Yes, here, see. So that is an abbreviation for this particular disease condition, gastroesophageal reflux disease, okay? Yeah, abbreviation is there. Then the next one, all the brackets, okay? So whatever things it's into a bracket, you can mark all the brackets, as well as all the italicized or bold words, okay? Then the words that indicate time. Okay, so what are they? Any idea? Give me some examples for words indicate time. Any examples? Can you please give me some examples for the words that indicate time? Okay, I'll give you two. Now, then currently. Anything else you know? Okay. Any other examples you guys know? The words that indicate time. Okay, often. Very good. Yes. Okay, always. Then recently. Okay, okay, Selin. Yes, recently. Okay, so be later as well as past. Okay. Then also post. Okay, prior, after, before. Presently. Very good, Mariama. Yes, presently. Okay, so now, currently, presently, before, after, then post, prior. Okay, later. Then what else? Okay, often, during. Yes, exactly. Then the next one, the words that indicate experiments, okay, experiment related words. For example, I can say observation, okay, then clinic or clinical observation, then identification or diagnosis, okay, ascertain, identify, find out. Then the words that can be connected with research topics, okay, for example, research related words, yeah, the word itself, research, researcher, then the study, population, aspects, okay. So all kinds of words you can mark. And the second last one is you can always give a special focus to all the first and last lines of each and every paragraph as well as all the bullet points, okay. So that's all about that. So now let's move to the first question, okay. So very easy questions from this particular material. The first question, the disparate diagnostic techniques employed to detect the presence of bad breath. Okay, so my keywords from the question, and as you know, guys know, when you read a question, always underline certain keywords from the question. Okay, so my keywords from the question which are disparate, so which means different. Okay, then diagnostic, then detect. Okay, so any idea what are the different diagnostic techniques used to identify the presence of bad breath? So where is it mentioned, in which text? Any idea? Yes, Mariam Maskaria, Selin Francis, Reba Rijo. Okay, so B. Any idea? First question, which texts? Okay, Selene, study, indicate, group, okay dear, yeah. So those are the words that can be connected with research, yeah. Okay, then what about the first question? Any idea what is the correct answer here? So my answer is from text B. Okay, so which is from text B? Because see, it's all about the identification or diagnosis. So how can you identify often? Always. A dentist will simply smell the breath of a person with suspected halitosis and rate the odor on a 6-point intensity scale. So we have some certain identification methods mentioned here. So of course that is from text B, different methods to identify the condition. Okay, so that's from text B. Then, okay Libby, very good dear, it's from text B. So second question, the effect of which component remains only for some times in the case of mitigation of bad breath? Okay, so my keywords, effect, then component, mitigation. Okay, so any idea? So the effect of which component remains only for some time, which means not permanent, it is for temporary. Okay, so some things are always temporary, right? Okay, yeah, so temporary only for some times in the case of mitigation of bad breath. So any idea? What is the correct answer here? Second one. Very good, Reba. That's from text D. Okay, a lot of components mentioned in text D. Okay, so chlorhexidine plus something else. Okay, a lot of components in from the last 3 bullet points. See? Okay, so yes, temporary effect on. So which means it is used for a particular period of time, not for permanent. Okay, so that's from text D. And the third question, which factor augments which you can say augmented, increased, augments which means increases the chances of bad breath in children. So what factor? Then augments which means increases, then chances of bad breath. Okay, so any idea? Third one. Okay, Reba, Libby, okay, Jobin, C. Philip, very good dear, it's from text C. Okay, Jobin? Okay, yes. So what factor increases the chances of bad breath in children? And that's from text C. So what are the factors? Okay, see, a lot of factors. Because of tobacco, if you're a smoker, there is a chance for bad breath, okay? As well as your food, okay, the food habits, then dry mouth, then crash diets, drugs, foreign bodies, as well as maybe because of some disease conditions, okay? So that's from text C. Yeah, fourth question. What conditions are accountable for the onset of dry mouth in people? So what conditions can be? Okay, so again, it's a very easy question because already we have discussed about what are the different factors that can lead to bad breath, okay? So here, what conditions are accountable for the onset of dry mouth in people? So again, so that dry mouth is only mentioned in text C. Okay, see, saliva naturally cleans the mouth. Okay, so yeah, it's all about the dry mouth. Again, that's from text C. Okay, so fourth one, text C. Then fifth one. Okay, Libby, fourth one is also from text C. What about fifth one, dear? Any idea? Okay, so fifth one, what measures can be executed to manage bad breath? So what are the different treatment options maybe? So not treatment options, not directly they have mentioned about certain treatment options here, but still, what are the measures can be executed to manage the condition, okay? So what about that one, fifth one? What are the measures or what are the treatments that can be executed to manage bad breath? Okay, so we have a lot of options available. So as you can see here, in text D, see, so what are they? For example, mouthwashes. Okay, then a lot of medicines, or sometimes, yeah, something is mentioned here. Yeah, very good, Libby. That's again it's from text D. Okay, the measures. Then sixth one, what is the prevalence of bad breath? So what about the spreadness? Okay, which means about 100% of the population, we can say, yeah, this much of the population are experiencing this particular condition. So, and that's from text A, directly mentioned, according to the American Dental Association, at least 50%. okay, of the adults have had this halitosis in their lifetime. Okay, so that's all about the prevalence mentioned. So that's from text A. Clear? Okay, so the final question from 1 to 7 set of question. The area that is considered as the source of smell in patients suffering from bad breath. Okay, so the area, then source of smell, okay, suffering. Any idea? 7th one, what is the correct answer here? The area that is considered as the source of smell in patients suffering from bad breath. Okay, and that's also from text A, because yeah, text A is all about what is, okay, or what can be, how can explain this particular disease condition. So definitely it's from text A. Breath odor affects everyone at some point. Then bad breath also, it is known as halitosis or fetor oris. Odor can come from the mouth, teeth as a result of an underlying health problem. Okay, so that's from text A. Okay, so any doubts regarding 1 to 7 set of questions? Okay, so that's clear, right? Okay, so now we are jumping to the next set of questions, that is 8 to 14 short answer questions. Okay, so you can write it in a word or a short phrase. Okay, so what do you mean by short phrase? A phrase which means combination of words, and it can be 5, 6, okay? But short phrase here means, yeah, you guys know that, right? It's maximum 3 words. Okay, Reba, yes, so be 7 out of 7. Okay. So please comment your answers, okay? So that I can know. Yes. So 7th, 8th one. The levels of which components can be abbreviated? Abbreviated, which means here decreased or what is the apt word? Yeah, reduced. Okay, by establishing thorough cleaning of the tongue surface. Okay. So the levels of which compounds? So which compounds? An idea? Compounds, which means, yeah, they're asking you regarding a plural something. Okay, compounds. So the levels of which compounds can be reduced by? Okay. Yeah, compounds is already there in the question. So answer is volatile sulfur. Okay, so where is it mentioned? And that's very easy to identify because it's from the, yes, text D, the first point. So to reduces the approach reduces the levels of volatile sulfur compounds by more than 70%. Okay, so answer is volatile sulfur compounds. So already compounds is already there in the question. So you can write what? Volatile sulfur. Okay. Okay, Vaishnavi, yes. Anne Maria, okay. Reba, yes. Mariama, okay. Tanka, yes. It's volatile sulfur. Okay, so the 9th one. Whose reports show the prevalence of bad breath up to 50%? So, yeah, 50% already you guys know what is it mentioned. And prevalence already we have done a question like this in the previous session. Okay, in the previous session, I mean, yeah, into 1 to 7 set of questions here. Okay, so I'm just moving to text A. Okay, yeah, 50% is mentioned here. Also the prevalence is mentioned here. So under what? Okay, Selin, the American Dental Association. Okay, very good. So that answer is American Dental Association. Okay. Okay, so what about the question? Yeah. Okay, so here I would suggest you to write American Dental Association because already the article is mentioned here in the question. See? The. Okay. So we have 3 articles, A and the. So the is already there in the question, so you don't have to repeat the same. So answer is American Dental Association. Okay, okay, Riba, yes. Selin, okay, and Maria, Sobi, it's from text A. Yeah, it's from text A. Okay, so 10th question. Which device is used to ascertain the quantity of sulfur? So device, name the device. Ascertain, which means what? Find out. Okay, or you can say identify the quantity of sulfur. So again, my keywords: device, then quantity, then sulfur. Okay, so I think my answer is from, any idea? Okay, already you got the correct answer. Okay, halimeter. Okay, okay, Libby, yes. Anne Maria, Arati Krishna, Maria Maskaraya, yes, it's halimeter from, where is it mentioned? Halimeter. Okay, so that's from here in text B. This detects low levels of sulfur. Okay, so what detects? Which device? The name of the device, that is halimeter. Okay, so that is the correct answer. Very good, right answer. Okay, so now we are moving to the next one, 11th one. The triggering of which device, disease can also be expected from the tobacco products other than bad breath. Okay, so the triggering of which disease? So what disease or which disease can also be expected from tobacco products? So we need to know which disease. Okay, so what is the name of the disease? Any idea? 11th question. The triggering of which disease can also be expected from the tobacco products other than bad breath? Okay. Okay, Selin. Any other answers? Okay, so that's from text C. Okay, see, one of the factors is tobacco. So tobacco products cause their own types of mouth odor. Then additionally, they increase the chances of gum disease, which can also cause bad breath. Okay, very good, right answer. Okay, Selene, it's gum. Okay, Mariama, yes. Reba, yes. Tangasuda, yes. Libby, it's gum. So this is already there in the question, so you don't have to repeat again. So answer is option, not option, yeah. The right answer is gum disease. So answer is gum. Okay. Then 12th one, the disease that can cause bad breath due to the regular reflux of stomach acids. Okay, so my keywords, disease, then regular reflux as well as acids. Okay. So any idea? 12th one. The disease that can cause bad breath due to the regular reflux of stomach acids. Okay. So that is a very usual condition. Okay. So which is from, yeah. So where is it mentioned? That's from text C. Okay. So what is the diseases? Some cancers, liver failure and other metabolic diseases can cause halitosis due to the specific mixes of chemicals that they produce. Then gastroesophageal reflux disease, or you can write GERD. Okay, can cause bad breath due to the regular reflux of stomach acids. Very direct answer. So either you can write the full form, whether it is gastroesophageal reflux disease here, or you can write, okay, GERD. Okay, so that's that. Then 13th one. Which test would help you to find 3 volatile sulfur compounds? So, which test? Any idea? What is the name of the test? Would help you to find 3 volatile sulfur compounds. Again, 13th one. Okay, so yeah, I think the name of the test which is mentioned in, yeah, diagnosis text B. And the answer is gas chromatography. Okay, so this test measures 3 volatile sulfur compounds here. Okay, hydrogen sulfide, methyl, mercaptan and dimethyl sulfide. Okay, so or dimethyl. Okay, so that's from text B. So answer is gas chromatography. Okay, so now the last question, 14th one. What are the other names of bad breath? Very simple question. So what is the name? What are the other names? Okay, so that's from text A, whether it is halitosis or fetor oris. Okay, so that's that. So now it's time for doing the last set of questions, 15 to 20, which are fill in the blanks. Okay. Okay. So yes, first one. Then 15th one. So okay, Tangasuda, actually halitosis is the correct answer, but they are asking you other names. Okay, dear, names, which means plural. They need more than one. So halitosis plus something else. So that is fetor oris. Okay, so 15th one. Dash is a tranquilizer that can produce odors as they break down and release chemicals in the breath. Okay, so dash is a tranquilizer. So what is a tranquilizer? An idea? Break down, release chemicals. Okay. Any idea? Yes, Mariamma, it's not, it's, yeah, your answer is correct. It is halitosis, dear. But in the question, they're asking you the names, okay, names which means perigal nana. Okay, so that means plural, more than one we need. So that it is halitosis plus fetor oris, okay. Okay, then 15th one, any idea? So I think answer is very direct, which is from text C, okay. So what is mentioned here? Yeah, I found that keyword tranquilizers here. So what is mentioned? Examples include nitrates used to treat angina, some chemotherapy chemicals, and some tranquilizers such as phenothiazines. Okay. So yes, answer is phenothiazines from text C. Okay. So the next one, a foreign body. So a foreign body, yeah, it's from text C. Lodged in the dash of the children. Again, that's from text C. Okay. Increase the chances of bad breath in them. Okay. So I'm just moving to text C. See. So what is the correct answer here? Okay. Foreign body, bad breath can be caused if they have a foreign body lodged in their nasal cavity. So answer is nasal cavity, right? Especially in children, especially in them. So answer is nasal cavity, which is from text C. Okay. Then 17th one, persistent bad breath or a bad taste in the mouth may be a warning sign of gum disease caused by the buildup of dash on teeth. So what on teeth? Again, so what is bad breath? Okay, so maybe from text A. So what on? Okay, see, persistent bad breath or bad taste in the mouth may be a warning sign of gum disease or periodontal disease. Okay, so answer is gum disease. Okay, so not an answer, it is gum disease is caused by, that answer is here, the buildup of what? It's the buildup of plaque on teeth. It's not gum disease, already gum is mentioned in the question, gum disease is there in the question, so answer is, okay, so that is plaque on the teeth, so that is plaque. Okay, then moving to, yes, so the third last. Additional reduction of volatile sulfur compounds can be achieved by periodontal treatment and the use of dash. Okay, so 18th one. Additional use of what? And that's from text D. Maybe they're asking you regarding the measures. Okay, so what you can use for that? And that's, yes, see, additional reductions of volatile sulfur compounds levels can be achieved by periodontal treatment and the use of mouth washes. Okay, so answer is mouth washes. Clear? Not mouthwash, mouth washes. Okay. And the second last question, if gum disease continues untreated, it can damage the gums and dash. Okay, and what? Gums and what? So yeah, it's from text A. So the last line, see, bacteria cause toxins from which irritate the gums. If gum disease continues untreated, it can damage the gums and jawbone. So answer is jawbone. Okay. Yes, very good, Georgie. Yes, it's jawbone. Okay. Okay, Sudha, it's jawbone. Okay. Okay. And the last and final question, 20. So dash remains as the most efficient anti-plaque and anti-gingivitis agent. Okay, so that is what? Dash remains as the most efficient. Okay, so again, it's from text D. Okay, so any idea? So that answer is from the third bullet point here. Chlorhexidine remains the most efficient. So these are the keywords from the question. So answer is chlorhexidine from text D. Okay, so that should be chlorhexidine from text D. Okay, so any doubts regarding any of the questions here? Okay, so may I know how many of you got 20 out of 20? Okay, so that's all about today. So please stay tuned for tomorrow. So see you all. Good day. Thank you.